Hi Jessica. My dad's going to start with a 360 around the room and then we're going to get started with our sterile wound dressing. Okay, so before I get started, I'm going to make sure to give the patient analgesic 30 to 40 minutes before the procedure begins. I'm going to check the doctor's orders and I'm going to introduce myself. I'm going to give my designation. I'm going to confirm the identity of the patient by asking them their name as well. I'm going to check their hospital bracelet. I am going to explain the procedure as we are going to do it. Basically, it is a sterile procedure, so I want to let them know so for their own comfort level and so they don't try to reach over the sterile field, which is a no-no. We want to keep them safe and myself is safe as well. So I'm going to make sure that they are comfortable. I'm going to see if they need to void or if this is a good time. And once I get their consent, I'm going to raise the bed and I'm going to provide privacy. So the first thing I'm going to do is I am going to perform hand hygiene. So for purposes of the video, we're going to say that this is nice and above waist height because that's where it's supposed to be, but for space's sake, we cannot do that. So the first thing I'm going to do after the hand hygiene is I'm going to put on a pair of clean gloves. So while I do this, I'm going to talk about what I'm going to do, which is check the wound as it is. So there are going to be two layers of packing on the wound. There is the topmost layer and then there is a ribbon layer on the inside. So we want to remove those. So while I put these gloves on, I'm just going to talk about what we're going to do. So we want to hold the skin taut so as not to harm the patient anyway. And we're going to pull at the tape towards the wound. That way there's no tearing of the skin. We're not going to risk hurting the patient at all. Okay? So we're going to lift the tape that way towards the wound, again towards the wound, and we're going to look underneath. Now this layer happens to be dry. We're going to douse it with some normal saline and come back once it's wet and it's easier to remove. So what I'm going to do is I'm going to pinch the packing and we're going to see if we can remove that all in one go, make it nice and easy for the patient. And now that this has been removed, we're going to look at it. So what we want to check for is any exudate, any pus, purulence. We want to check for any bleeding, any foul odors, anything that shouldn't be there we want to look for. So after we've done that, we're going to roll that into a ball and we're actually going to slip that off with the glove to make sure that no debris gets anywhere it shouldn't. Now once those gloves have been removed, we're going to put those into the trash receptacle there and perform hand hygiene again. So now that that is clear, we want to look at the wound. We want to look for the exact same things. So we want to see if there's any bleeding, any purulence, any pus, any foul odors, anything that shouldn't be, exudate, any of that. So it looks okay. What we want to do is measure the wound. So hand sanitizer again, and I'm going to don another pair of clean gloves. So while I try to fight these onto my hands, I'm going to talk about what I'm going to do next, which is to measure the wound. So I'm just going to talk about it because I have a sweating condition and the gloves are a little bit hard to get onto my hands. So to save time, I'm just going to talk about what I'm going to do. So what I have is a cotton swab. I have two of them because I want to do two different measurements. So I want to check the wound for its length, its width, its deepness, and I also want to look for any undermining or tunneling. So I have my cotton-ended swab ready to go. And I'm just going to open those from the bottom down. So I'm going to take one, and there's a measurement on the outside here. So I'm going to use my fingers as a measuring point. So from end to end, my hand right there, and looking along there, it's 9 centimeters. I'm going to measure the width at the widest point, finger as an indicator, 2 centimeters. And I want to go to the deepest point, and again use my finger, and that too is 2 centimeters. So I'm going to drop that in the receptacle. And as I mentioned, tunneling or undermining, I want to see and make sure that there is nothing that shouldn't be there. So I'm going to gently swab the inside of the wound. I want to make sure, moving about, that it doesn't go in anywhere. There's no tunnels, there's no rolling of the skin around the edges, checking the top, it's all good. So we're going to toss that as well. And we're going to remove the next set of gloves and again perform hand hygiene. Okay, my hand hygiene's down here. So the next thing I want to do is set up my sterile field. So I'm going to open this. Now this is my dressing tray. Before I get started, we always have everything all set and ready to go. But to save time, I just wanted to tell you about each product as we touch it, just because we're trying to save some time for our video. So we want to start by opening away from us and pulling nice and taut. We're also going to open the sides next. And the last part we have to be a little bit careful about because this is where our forceps live. So these have to remain sterile. So we can touch where our hands go, but the tips have to remain sterile. So we're going to open lastly towards us, and we're going to pull this taut, as I mentioned, because we don't want to go over the sterile field at all. Now this right here in the middle is the extension of our sterile field. I can touch this right now because it hasn't touched anything yet, but once it has been opened, the 2.5 centimeters around the outside is considered contaminated. So what we're going to do with this is we're going to put it right here. That way, if we drop anything or I have to put anything down, the area remains sterile. So the next thing we're going to do is we're going to set up the actual sterile field in the sterile field. So if you want to move this away, I'm going to come around. So we're going to set this in the middle as much as possible, and this is where we're going to add everything. So as I mentioned, 2.5 centimeters around is not sterile, so we do not want to touch the tips, but I can move it a little bit. So what I'm going to do, leave the outside and just have the inside on the inside, and I'm going to open everything that I'm going to need. So there's a few things that I'm going to need. First off, I have my 4x4 gauze, and I'm going to peel that open. Use my forceps, add that to my field. I'm going to do the same thing. This is a sterile abdominal pad. Open it like a banana. We're going to peel it away. Add that to the field as well. There's a few more things we have to add. For instance, we have our 18 gauge blunt needle. Now, in a hospital setting, we would have a 19 gauge angiocath, but this is what comes in our kit. So we're going to open that again like a banana. Pull that out, add it. This is a 30 milliliter syringe. Open that, add it to the field as well. And there are just a couple more things to add. So I have sterile scissors. And for these, I can either add them to the sterile field or put them on the side just like these guys go. I'm actually going to use them for more mobility, so I'm going to keep them on the edge like so. And then I have two more things. So I have my normal saline. So what I would do is I want to check the bottle for an expiry date. If it's already been opened, I want to make sure it's within a time frame that is respectable for my hospital's procedure and policy. So I'm going to make sure to not occlude the label. So what I want to do is hold the hand over the label, and I'm going to lip the bottle. I'm going to just pour a little bit into the trash receptacle, and that makes this nice and sterile right here. And then I'm going to add that to the field. We're going to make sure not to do any splashing because a wet field is no longer a sterile field. And once that is there, I can add the last step, which is the packing strip. So this is where the scissors and the pincers come in handy. So normally I would check what the previous nurse used. So I know about what she used because I removed it myself, but I would definitely check. And this is where I want to do my cutting. And I'm going to add that to my field. So now that my field is all set up, I'm going to provide hand hygiene for myself and put on my sterile gloves. So, hand hygiene. So for the sterile gloves, there is a procedure. So we're going to start by opening the outer package. So the outer package, once it's opened, remove the inner package. I'm just going to put that right over there. Now the inner package, we open it like so. First, we open closer to us, me, and then further away. And then there's going to be a lip right here on the inside. So what we want to do is we want to grasp this, because just like the sterile field, this is sterile only on the inside and not on the outer 2.5 centimeters. So we're going to hand hygiene again. That way we can put the gloves on. So there's a very specific way we have to do this. So dominant hand first. I'm going to take the bottom of the glove, tuck in my thumb, and slide my hand in. Hopefully much easier than the clean gloves went on. And I'm going to leave my the bottom of the cuff as is while I put on the next glove. So Once that's on, I want to take the inside of the glove by the cuff, like so. And again, I'm going to tuck in my thumb and I am going to slide on the next glove. So once the second glove is on, is when I can make sure that they are nice and snug, if they ever want to get on. So I've pulled that down, now I can pull the cuff down, and now that my non-dominant hand is done, I can pull this cuff all the way down, and then I'm going to intertwine my fingers. We're good to go. So moving back to my sterile field, the first thing that I need to do is attach the needle to my syringe. So what I'm going to do is I'm going to pop it on, and I'm going to turn it so it snaps into place. Once that's done, I can remove the cap, and I will put some normal saline into the syringe. So I'm just going to gather a little bit. So when we raised the bed earlier, we positioned the patient so that we can clean the wound. We don't want any pooling in the bottom of the wound. We want all of the normal saline to wash out with anything else that we're washing out with it. So starting from the top, we're going to move back and forth in a zigzag from the top to bottom, making sure there's no pooling, and we're going to run this until it runs clear. Once it runs clear, we can put that back in our sterile field. And then what we're going to do is we're going to go ahead and clean. So I'm just going to move this, it's a little bit easier. And we're going to take our 2x2 and we're going to clean the wound. So what I'm going to do is I'm going to put this in the normal saline, and we don't want it soaking. So what we're going to do is get out all the extra, and then we're going to clean the wound. So starting from the top, moving down and turning as we go from the furthest bit down. And so you're going to drop that. We're going to do that again for the side closer to us. So same process, we're going to wet the 2x2, squeeze out all the excess water, normal saline, I'm sorry. And this time we're going to do closer. So again, we're going to top to bottom and rotating as we go to make sure it's nice and clean. And drop that again in the trash receptacle. Now it is at this time that if we were to need a culture, we would do so. So we want to find the cleanest place where there is no pus, no exudate, the healthiest part of the wound. That's where we open the culture, dip it in, be very gentle, turning it slightly, close it, label it, add it to our field to be sent off for later, and this is our last step. So what we want to do here is very important. This is what we took out earlier. So we want to get this in the normal saline and nice and wet. Now, because my hands are sterile, I can do this way. And what I'm going to do is I'm actually going to just wrap this around the fingers of my non-dominant hand so that I can fill the wound. So what I'm going to do is I'm going to go from side to side, and we want to make sure that every bit of the wound is filled to the top of the skin. So moving from left to right, from top to bottom, we want to make sure that the wound is filled, because it's not going to heal right if there's any open space, we can get air in there. So moving from side to side, back and forth, we make sure this is nice and full. Looks good. Now that that is done, we're going to take our 4x4 that we opened earlier. We're going to put that over top. And then this is the abdominal pad. Now you can see there's a blue line. This is a wetness indicator. White side is down, wetness indicator is on top. We do that so that if there's any exudate, then we know about it and we can check the wound. So now I can remove my sterile gloves. And once I do that, I can sanitize my hands. And lastly, we're just going to attach it. So we want to go on all four sides. So side to side and top and bottom to make sure that it is secure. We want our patient very comfortable as much as possible. So we're going to have this nice and snug for him or her. And then once that is done, we can move their blanket back up so that they are comfortable. We'll put their bed back down. We will remove all our sharps. We don't want either the patient or anybody else to get hurt by this. And we're going to document for the doctor, for the next nurse, any pus, exudate, the amount of gauze ribbon that we used, and we're good to go.
15 minutes, bang on the button.
Okay. Did I break sterile procedure at all?
Doesn't matter.
You're still recording, Daddy.
Okay.